Dr. Kelly Byam, and I own Abel Pet Clinic in Elk Grove, California. I've had that practice since 2000 and have been practicing veterinary medicine for over 21 years. And during that time, I've learned a whole lot about the art and the science of veterinary medicine and veterinary dentistry in particular. Well, just like in people, periodontal disease is a leading cause of aging and premature death. So if you think about it, doggy breath is really infection. That's what you're smelling, and that bacteria is working in your dog or cat's bloodstream all the time, poisoning all of its internal organs and shortening the life and causing pain. Dental health is related to health in general, and that's why people are living so long. You know, before we had good dental hygiene, people were dying in their 40s with George Washington had wooden teeth. They all had wooden teeth. They didn't know how to take care of them like we do now. Well, the answer is yes, it does cause pain, and sadly, it's hard for us to know it because dogs are stoic and they are just, it's in their DNA to eat and pursue food. So I have seen dogs eat when they've got horribly fractured and abscessed teeth. So just because your dog doesn't go ow, 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 doesn't mean he's not in horrible pain. And often, sadly, the only way you realize that they were in horrible pain is after a dental surgery and we remove abscessed or infected teeth. Then the owners say, I can't believe it, he's acting like a puppy again. And it's easy enough at home to just, you know, dogs are always wanting to kiss you, be in your face. Go ahead and flip that lip once a week. Have a look at the gums. Do the gums look puffy? Do they look inflamed or red? Because it should be a nice pale pink. And if you see puffiness of the gums, that's a sign of periodontal disease. If you smell bad breath, well, that's bacteria. That's a sign of dental disease. And sometimes the worst problems you can't even see by looking in the mouth. You can't tell without an x-ray because a lot of the disease is below the surface of the tooth where you can't see it at all. Yes, there are different styles of dentistry, and not every veterinarian does dentistry to the same level. It sort of depends on their level of interest and expertise and the equipment and the people that they have there. So some people are doing non-anesthetic dentistry, even lay people are doing this. And this, in my opinion, is about the worst thing you can do to your dog. It's only a cosmetic procedure. That's all it is. There's zero medical benefits to a non-anesthetic dental because all it does is superficially clean the crowns. That's not where the disease is. The disease is below the gum level. So unless you're treating below the gums, you're not treating dental disease at all. You're just making it pretty, but you'll find that in a couple more weeks, you will smell that horrible smell again because you didn't actually get rid of the infection. You just superficially cleaned the tops of the teeth. Now, in veterinary dentistry, the type of equipment that you use has a big impact on the quality of dentistry and dental surgery you can do. In my opinion, the most important piece of equipment is the dental x-ray. Without the x-ray, you have no idea what you're missing. And that is the one thing they absolutely cannot do in an awake animal. They have to be under general anesthesia to get an accurate picture using digital dentistry, using the radiography, the x-rays. They have to be completely immobile, and you can only do that in an anesthetized patient. I think the perception is people think it's real dentistry, which it isn't, and people think it's safer. And because they're terrified of anesthesia, but veterinary anesthesia has come so far. We do everything we can to mitigate risks. And the most important thing is anesthetic dentistry is painless. I empathize because I have sensitive teeth. I can't stand having my teeth cleaned. Sometimes I even need the gas because it hurts so much just to scale my teeth. If you can imagine, if you've ever needed a root canal, if you've ever had an abscess, how horribly painful it is to have anything even touch that tooth. And I'm just horrified thinking about someone forcibly holding an animal down and using sharp metal instruments against a painful tooth. And again, dogs don't show signs of pain. They trust us. They let us do things that are painful. And I just think this is the most horribly cruel thing that you can do. There are some cases where it might be acceptable in a very, very young dog, but really, once they've reached the age of 3 or 4, most of my patients have some degree of periodontal disease, and you're talking about needing to clean below the gum line. In term that I like to use is COHAT. And COHAT is spelled C-O-H-A-T, and it stands for a comprehensive oral health assessment and treatment. So if you were to go to your dentist, they would shoot x-rays, they would find the disease, and they would set up a time, an appointment in the future so you could address that disease. Well, in veterinary medicine, 2 weeks from now is today. You're not going to re-anesthetize the animal, so you find out what level of disease there is, hopefully using digital dental x-rays, intraoral x-rays, and then we call the owner and discuss what the treatment plan is. So it's one thing to find the disease, and then it's another to stage that disease and decide what needs to be done. You can't do that without x-rays, you can't do that without periodontal probing. And again, of the two, dental x-rays are more valuable. Well, I think it's important that you have at least an annual veterinary exam and discuss it with your veterinarian. It's going to depend on the type of disease that your animal has. Some of them, especially the smaller toy breed dogs, are really prone to periodontal disease. So every dog is different. So I can't say every dog needs dentistry every year. A big Labrador may only need to have its teeth cleaned once in its lifetime. A lot of these working dogs have excellent teeth. But these dogs, especially the little toy dogs and anything that's been bred to be a different size, they've got a lot of dental disease. And some breeds that you don't even think about, like a greyhound, really bad dental disease. Collies too would be another group that's got disease like that. Shelties too. So it just depends on your dog. And I would have this discussion with your veterinarian, just knowing if you can keep that mouth clean, you can really extend your pet's quality of life as well as quantity of life. You're going to help them to live longer and healthier and happier. I guess, again, stressing the importance of home care. If you can look at your animal's mouth once a week, just flip the lip, you'll be able to see, you'll be able to smell. If you want to keep good oral hygiene in your dog or cat, there are dental chews that are available. Toothbrushing is the gold standard, but not all animals will accept toothbrushing. So the best time to start that is when you have a puppy or kitten, and everything is new to them, so it's not going to be surprising when you're brushing their teeth. But if you could brush like even twice a week, that would make a huge difference, will save you a ton of money, will actually keep them out of needing dentistry for a lot longer. So home care is super, super important. At my practice, one of the things I realized was that cost was a barrier to care. So one of the things that's been really well accepted at my hospital has been the institution of our payment plans for dentistry, where it's going to cover most of the costs of cleaning, well, all of the costs of a cleaning, and then most of the costs of additional work that might need to be done beyond a cleaning. And we have very few dentistries, unfortunately, that are just a preventive cleaning. Most of them, we do find disease, and we'll find teeth that need to be extracted. And we have payment plans that will make it so it's not such a large out-of-pocket expense. And it's not even like putting it on a credit card because there's zero interest. So it's been really well received, and I'm happy that it's helping more animals to get the care that they need.